There was an external review requested by the Missouri Veterans Commission to investigate the cause of a prolonged outbreak of COVID-19 at Missouri veterans' homes, and that review has now been released. Since the release of the investigation, the chairman of the commission resigned. KOAM's Chris Warner reviewed a copy of this report and has more.
In September of 2020, the veterans' homes operated by the Missouri Veterans Commission experienced a prolonged outbreak of COVID-19. As of November 13th of last year, there had been 103 deaths. So the commission requested an independent investigation into the cause and the commission's response. The investigation was concluded and the report released. However, a report from the Associated Press says chairman of the commission, Tim Noonan, resisted releasing the entire report until Attorney General Eric Schmidt directed him to do so. The results of the investigation say at the state level, the MVC failed to recognize the outbreak, failed to plan for an extensive outbreak, and failed to respond to the outbreak. The report broke down each veterans home in the state and their individual response. Locally, at the Mount Vernon home, the report noted the home had instituted many positive practices and that at the time of the report, the outbreak was contained to the isolation unit. However, it also noted 3 key deficiencies, saying there are concerns regarding the practices of the Mount Vernon home that may have contributed to the spread of COVID-19 amongst its veterans and staff. Those 3 points of concerns are, first, there is no evidence of general infection prevention and control policies and procedures. Second, education on procedures is not in compliance with COVID-19 guidance, including hand hygiene. And lastly, communication and directives from headquarters change frequently, creating confusion and inconsistent practices. The report says the administrator of the Mount Vernon home says earlier access to testing may have helped quickly identify positive staff. According to the report, one staff member reported symptoms of COVID-19 in September and was asked to continue working, which the report says the staff member attributed to low staffing. However, the Mount Vernon home has only reported 9 deaths, which is 4th lowest in the state, behind St. Louis, Mexico, and Warrensburg. According to the report, headquarters did not prepare or anticipate an outbreak and develop a plan. Instead, it relied solely on the state's guidance on influenza. Because of that, the report states one staff member says the staff felt it was, quote, flying by the seat of their pants in terms of COVID outbreak preparation. In Mount Vernon, Chris Warner, KOAM News.
We reached out to the Missouri Veterans Commission and the director of the Mount Vernon home. The MVC sent a statement saying in part, quote, MVC has already implemented corrective actions identified internally or recommended in the independent review. The full statement and the full 415-page report are in this story on our website, KOAMnewsnow.com.